Okay, so can you tell me a little bit just about yourself in general?
Yeah, so I'm Humility Sumayang. I'm actually a director of nursing, currently working as a director of patient care on a surgical oncology unit at one of the hospitals here in New Jersey. We're actually the largest healthcare system in New Jersey.
Wow, that's nice. So, what inspired you to work in oncology nursing and specifically on a cancer unit?
I think because cancer has actually affected and impacted a lot of lives, and I've been impacted by cancer personally from family members that have been sick of cancer. So I think that's that's where my passion is. And that's
Okay.
how I found like my passion for oncology.
Yeah, so what do you believe are the most critical factors in promoting breast cancer awareness, especially among underdeserved populations?
I think like really getting on the ground and really going, visiting, and educating them. I think community health education plays a pivotal role in making others aware of the risk factors of breast cancer and how to prevent it or like find an early detection. And I know our the underserved population, some of them really have a hard time going to the hospital or even getting an annual visit. So I think like getting on the ground, going there and really providing one-on-one education with these people.
Yeah. I think that makes sense because a big thing with cancer is like obviously it's unpredictable, it
Mm-hmm.
can spread extremely fast. I feel like yeah, like finding out about it early and like doing early prevention is something for sure that's
Yeah.
super helpful.
Early
Um
detection or prevention really is the best cure.
yeah. So what role do nurses play in promoting like breast self-awareness and encouraging regular mammograms?
Nurses play a major role as healthcare providers. Like, you see nurses everywhere. You could see them in the community, see them in the hospital, outpatient, ambulatory areas. And I think as a nurse, like providing that education, whether or not you're at work or like wherever you are. And I think like, you could be the best role model for your family or to your friends as well.
Yeah. So what strategies do you use to address the emotional and psychological needs of breast cancer patients? Because I'm sure, you have a bunch of patients with different emotions and different approaches to this.
I mean, not just only for breast cancer, really, there's
Yeah.
a lot of resources or like that cancer patients or breast cancer patients do have. And I think breast cancer is one of the most supported cancers in the world or even in the United States. And on the unit, there's the chaplain, there's support groups that we refer them to.
Yeah.
Um, like just providing a healing environment for our breast cancer or any other oncology patient. So there's a lot of resources out there, like emotionally, mentally. There's peer support group. There's what you call this, the chaplain, religious services. Like there's just a lot of resources for them.
Okay, so that's kind of just moving into my next question. You mentioned
Mm-hmm,
some resources that they have like support groups and whatnot. Is there
mm-hmm.
anything else besides like the ones that you previously mentioned that you recommend for not just breast cancer but in general any cancer patients and maybe also their loved ones that are, like mentally affected by their family members?
Yeah, I actually was about to mention that there is a caregiver support group out there. Um, the social workers actually they have like a, an extensive like list of like resources or support groups that our patients and family members can tap into once they leave the hospital. So like they're not going to be alone when they leave the hospital. So there's always that support for them. And nowadays you have those oncology navigators and the oncology navigators are great at providing them resources and networking.
Yeah. Um, so as far as like your staff, like how do you ensure that they're being supported in providing care to patients with breast cancer? Because of course it's not sometimes, like the
Yeah.
healthcare providers themselves can be affected by what they see around them.
So we do provide a lot of resources to our staff. We have the employee assistance program, um, and actually right now we are in the process of um, doing we actually have a virtual reality project. So
Yeah.
um, a couple of years ago, a couple of my staff attended the Oncology Nursing Society conference, and there was this one hospital that implemented a virtual reality program to help with de-stressing
Hmm.
from their day. So it's really just a 10-minute virtual reality, and research showed that this really helped like de-stress or help the nurses from burnout during their shift. So actually it's been 4 weeks now, and we have a couple of nursing DNP students that are helping my staff do this. So and the feedback from the staff has been really great. And I know like where I previously worked, we had an oasis room where we allowed our nurses to go and decompress from their shift, like a 10-15 minute break. We also provided like religious and spiritual help. We did debriefing sessions for difficult oncology cases. So we do provide a lot of support for our staff.
The a virtual reality thing, that's something that I've heard for the first time. That sounds
Yeah,
very
it's really
interesting.
cool. Mm-hmm,
Yeah.
it is.
So, like speaking of virtual reality, I just feel like nowadays, like technology is evolving so fast. So, in the future, like, how do you envision the future of like breast cancer treatment, changing, and what role do you see nurses playing? Like, do you think that they'll still be as important towards patient care? Do you think that like artificial intelligence will, start to have a greater impact in that end?
I don't think like artificial intelligence would ever replace nurses, but I'm sure their AI will be a great resource tool for nurses. So I really see a cure in breast cancer in the future. There are some treatments right now that I see really cure certain types of breast cancer. So I see how AI can support research in
Yeah.
breast cancer treatment, and I also see how AI can support nurses and patients in the future. And I hopefully I see a cure of breast cancer in the future.
That's good to know. So overall, like throughout the years that you've, worked in healthcare, what has been the most challenging part of like your journey as a healthcare professional, like physically and emotionally, and how have you been able to cope with it?
I think I would say the most challenging would be the pandemic, obviously. The fear of the unknown, that was really very challenging the first probably 2 weeks of the pandemic. So, but again, as nurses, we're resilient, we're flexible, and just navigating through like the challenges during the pandemic, and now we're still navigating through like staffing, because I don't know if you've heard about this, but there was this great resignation of nurses, especially after the pandemic because of the
Yeah.
burnout. So that I think staffing and just really navigating through the pandemic was a major challenge for me.
Yeah. I have heard about that, and I know that that was a big thing, especially for patients, because there weren't enough, like doctors and nurses
Mm-hmm.
available to actually take care of them.
Yes.
Um, so as far as changes in breast cancer treatment, like have you seen any different changes as during like your time as a doctor, and as a nurse, and like how have they kind of impacted your outlook on the future? Because I know you mentioned like you feel like in the future there'd be an even better way to combat breast cancer. So has there been changes you've seen so far?
Oh, oh yeah. In my 18 or 19 years of working as a registered nurse here in the United States, I've seen um, the innovation and the different treatments. and I saw how breast cancer treatment has evolved. So, and I think it's like, we're getting in a positive direction. There's a lot of research out there. We're actually also a big research academic medical center. We're doing clinical trials. So, yeah, I've definitely, there's been a lot of change and like, positive in a positive direction.
That's good to know. And then lastly, just what is one key like message or takeaway that you want anyone that's listening to you to just remember from our conversation today? Because obviously with Meducate, we're trying to just address a lot of ongoing, issues regarding healthcare to people that are interested in pursuing medicine, people of my age in high school. So what's something that you feel like they should know that they can, like kind of get involved in regards to cancer and cancer prevention?
I think the number one um, cure or prevention is really the best cure for cancer, and educating everybody, having like that there are risk factors for breast cancer, avoiding those risk factors, having a healthy lifestyle really plays a major role in, I think, cancer prevention. And also like and get yourself involved, like you know um if you've been impacted by cancer, or like get out there, like educate, like I think like getting everybody to be involved, and like to prevent cancer in general, I think you should go out there. And yeah, if you see yourself in the future as a healthcare professional, like it's the time to get involved.
Yeah, no, these are all very good tips and advice. So yeah, I'm hoping that people are inspired and able to learn and get more involved in the community, like you said.
Hmm.
Um, so yeah, that's pretty much it. Thank you so much for
Thank you so
coming.
much.
It
Yeah,
was
it's been
so
a
nice.
pleasure.
Yeah, it was so nice